I did hours and hours and hours of research so that you guys don't have to. I finally have some sort of answer about what could possibly cause RFK's voice disorder. So if you want to take this journey with me, get your reading glasses because the library is open. What's up guys, and welcome back to my channel. If you're new here, my name is Destiny and I'm a licensed speech language pathologist, which is also known as an SLP. Now, a few weeks ago, I made a promise that I was going to stop making videos about RFK Jr., but I lied. I need to come clean. I am not done making videos about this man, and I blame you. I blame all of you for the comments. You guys have been leaving these amazing comments that are sending me down rabbit hole after rabbit hole to figure out what is the cause of RFK's illness. What caused his voice disorder? In my original video, which I encourage you to look at before finishing this one, I talked about how researchers really don't know what the cause of spasmodic dysphonia is. Once I started to see the comments that you guys left about the different theories that are out there, I had to do some more digging. As a licensed SLP, it's really important to me that we use evidence-based practice with our diagnoses and with our treatment. So for me, it was really important to look back at the research and ask the question, could a vaccine cause a voice disorder? Okay, so I think it's important to do a quick recap of the definition of spasmodic dysphonia. So I'm gonna read directly from Johns Hopkins Medicine. Spasmodic dysphonia is a voice disorder that causes involuntary spasms in the muscles of the voice box or the larynx. This causes the voice to break and have a tight, strained, or strangled sound. Now, in this article, if you go down to cause, it says the exact cause of spasmodic dysphonia is not known. It is thought that a central nervous system disorder causes most cases. So that would be something in the brain or in the spinal cord. It may happen along with other movement disorders. Some research has linked it to the basal ganglia of the brain, and this is the area that coordinates muscle movement. It says that this disorder may start after a cold or the flu, injury to the voice box, a long period of voice use, or stress. I couldn't find any specific piece of research that directly linked the flu shot to spasmodic dysphonia specifically, so I expanded my research to include any disorder of the vocal cord. I was able to find two specific studies that looked at vocal fold paralysis or immobility after vaccination. One of them included several different vaccines. The other one was specifically the COVID-19 vaccine. These studies were out of Rutgers University and the University of Virginia. The way that they went about this research was looking at the Vaccine Adverse Event Reporting System, or VAERS or VAERS. I'm not sure how to say that. You guys let me know in the comments. So the researchers in those studies took the VAERS database and they combed it for any confirmed case of vocal fold paralysis following vaccination. The Rutgers study found that 22 patients had a confirmed diagnosis of vocal fold immobility following the flu, shingles, pneumococcus, and hepatitis B vaccines. They found that 73% of those cases were unilateral, so that means one vocal fold was impacted. And they also found that this impacted more women than men. And they found that they would get this diagnosis, or they would have this adverse reaction between 0 and 45 days following vaccination. 4 of those patients were severe enough to be intubated or have a tracheostomy. The next study out of Virginia found similar results. They found 20 patients that had a confirmed case of vocal fold paralysis following vaccination. This one was looking at the COVID-19 vaccination specifically. So they included the Moderna, Pfizer, and BioNTech. And there were a few cases where it was severe enough to require intubation or tracheostomy. I'll talk about the limitations of both of these studies. They both were looking at the VAERS database. This is a adverse reaction reporting system. So they're only looking at a small percentage of people who did decide to report their adverse reaction. With that being said, there are confirmed cases of vocal fold issues following vaccination. Now, this included a variety of vaccines. That was not specifically the flu shot, and that is what RFK has reportedly said caused his vocal injury. So I wanted to see, could a flu vaccine be the cause of a vocal fold issue, or with the understanding that spasmodic dysphonia specifically is related to the central nervous system, could the flu shot be linked to some sort of neurological issues following vaccination? So bear with me here because there are a lot of words that I am not great at saying. I wanted to look at the actual insert from the flu vaccine, and there are a bunch of them, so I just picked one of the ones that are the most common. So I picked Florex quadrivalent. Not sure what that means, but it is one that is used frequently in both adults and children. They have to report some of the adverse reactions that happened in the studies that they did to determine whether or not this shot was safe for the population. And it's important to note that the reactions that they reported on were within 7 days of vaccination. So that's important because in the last 2 studies that I reported, adverse reactions were reported between 0 and 45 days. So this is after the window of time in which these researchers were checking for adverse reactions when they were determining the safety of this shot. Some of the most frequently reported adverse reactions were swelling, pain, redness, headache, fatigue, pretty much milder symptoms of the actual flu. Again, that was within 7 days of getting the shot. Something that a lot of people don't do is to look for the post-marketing experience. The post-marketing experience is the events that are reported after the approval of the flu shot. These are the reactions that people voluntarily report after they've received the shot. And if you scroll down to nervous system disorders, you can see that facial palsy, facial paresis, hyposthesia, neuritis, neuropathy, and paresthesia are listed as some of the reported reactions following vaccine. Something else that I was also interested in seeing was the respiratory part, because the respiratory system does include the vocal cords because it is the larynx. So something that I noticed was both respiratory distress and stridor. Stridor is a high-pitched thoracic breath sound resulting from turbulent airflow in the larynx. That's important. The larynx is the voice box and it includes the vocal cords. Now, why would there be a turbulent noise in the larynx? It would likely be related to some sort of mishap happening in the vocal cord. So what is my conclusion? I was not able to find a direct link between spasmodic dysphonia as a diagnosis and the flu shot. But I was able to find some information that could support the statement that vaccines could cause vocal injury. The 2 studies that I looked at first definitely confirmed that there are some cases of people, albeit small, that have seen vocal cord disorders following vaccination. When we look at the actual flu shot insert, which is found on the FDA's website, by the way, we can see some interesting reports of different disorders that could be linked to spasmodic dysphonia. I believe that it's plausible that RFK is telling the truth about his voice disorder. I feel like in science and research, if it's not a large enough population that's affected, they tend to sweep it under the rug. It's not fair to discredit each individual case and their experiences. So I'm going to say yes, it's possible that his voice disorder is linked to his vaccination. I really want to thank those who engage with my videos and leave comments because I really am learning so much from you guys. It really helps me to think outside of the box and be a better clinician. Be sure to subscribe to the channel so that you don't miss out on future videos. And if you want to learn a little bit more about the different voice disorders that are out there, definitely check out this video.